Now we're going to set the parameters for the eyelid procedure. To set the parameters for the eye-type procedure, the select button is pressed and the pulse duration is increased to 3 seconds. These are set for a pulse duration of 3 seconds with an off time of up to 5 seconds to allow the operator to move the fiber within the pocket. The power is set at 12 watts. A 14-gauge needle with a lure lock is used for treatment. The fiber is passed through the needle and secured at the proximal end. The upward bevel is important to allow the beam to shine through the skin. So the aiming beam is seen through the skin using the bevel in the upward position. If the bevel is reversed, the beam is blocked, and the surgeon cannot see the location of the fiber. So the fiber is placed into the cannula, and you can see it goes slightly beyond the edge of the tip. What I do is thread it a tiny bit so I know it'll go, and pull back. I don't want to perforate the skin with the fiber, I want to perforate the skin with the needle. The needle goes into the lateral canthal region in the crow's foot line, heads inferiorly through the skin to the orbital rim. And you want to feel the needle along the orbital rim. Then the needle is aimed medially along the orbital rim until you get some resistance. And that's the orbital septum. Then push anteriorly with the needle. The fiber is still retracted in the needle. I haven't advanced it yet. The needle is now parallel to the orbital rim, and I'm in the medial fat pad, and I'm going to push the fiber in, and now you can see it in the fat pad. And we're still in standby mode, so now we're going to go to the ready mode. It'll load the chip. So I'm going to step on the pedal, we're going to get 3 seconds of energy, and I'm going to keep my finger right on the Heaney beam. That was our 3 seconds. Now I'm going to retract it a tiny bit, and still in that pocket, I was inferior in that pocket, now I'm going to go superior in that pocket. Laser on. That was our laser exposure of the medial fat pad. Now we're going to go into the central fat pad. And there's the beam. Parallel to the skin, parallel to the rim, laser on. Retract back a tiny bit. Laser on. Now, to get the lateral fat pad is a little slightly different turn of the needle. It's often helpful to remove the needle from the pocket. The vector approach to the lateral fat pad is not so much horizontal but vertical. So you can see that I'm approaching the fat pad that way because it tends to be a little bit lateral and superior to the other fat pads. Now the fiber's in the fat pad, and you can see it's inside the dots that I outlined. Laser on. A few more seconds and we're done. That's treatment of that eyelid. Now we're going to go to the other side. Here's the lateral canthus. There's a crow's foot coming right off it. The insertion of the needle is lateral to the lateral canthus. Push through the skin, down along the orbital rim. And again, if you're along the orbital rim, you're deep to the orbital septum, so the fat is anterior to the needle. Here's the lateral fat pad. Here's the central fat pad. Here's the medial fat pad. The needle, which is along the rim, is now pointed toward the skin surface, and a push against resistance puts you into the fat pad. The fiber is then entered into the needle. Fiber enters the needle. Shields are placed. Laser is activated. Laser on. Withdraw the needle and the fiber. Here's the other part of the medial fat pad. Laser on. Go into the central fat pad. Laser on. Another part of the central fat pad. Laser on. And finally, to go in the lateral fat pad, there we are. I'm going to vector a little bit in this direction. The cheek skin can be distracted inferiorly to bring the fat pad down. Laser on. And again, last application of energy, laser on. Procedure's done.